Bo Daly, and who else? Nicole Hoffman.
Okay.
And Cynthia Ricks McAtan.
So Nicole's signing in.
And then Ennis. Who is Ennis? Hello, Ennis.
I'm just testing my microphone. Can you hear me?
Yes.
Okay.
Trying to remember who ENNIS is. Hello, ENNIS. Here's Dennis.
Looks like Carmela Ennis. Enos.
Carmela. Cynthia. Council President, I believe we have everybody.
Awesome. All right. So does everyone have the agenda in front of you? And you're ready to go? Joe, I sent an email to you asking if you'd be have anything to share about St. Francis and the emergency department that would be helpful to the group. Would you like to do that during this meeting?
Yeah, I can share a few things.
How about if we'll do that after the city attorney speaks? Is that okay?
Sure.
All right, awesome. Thank you. So thanks. We'll go ahead and get started. Thanks for being here. When we sent out the agenda, I don't think we put an ending time because I didn't get much feedback on going to 2 hours. One person replied that they would be willing to go to 2 hours, but would like to keep it at 1.5. So we'll see how it goes. And if necessary, and we're still having a productive conversation, if it's okay with everyone, we can try, go to 2 hours. If not, just let me know and we'll close things down. So thanks for being here. I need to let everyone know before we start that we are open to the public tonight. People can be watching this on Zoom or on Facebook, but they cannot participate. And just letting you know that. And if you would like to speak, if you could use the raise hand function. If you can't find that, it's okay to raise your hand. And if I don't see you, let me know. And other than that, let's just go around and say our names and anything you'd like us to know, and then we'll have the city attorney talk to us. So, Bob?
Bob Drake, been in around the federal community with businesses, residences, raised 2 kids here for some 40 years. Been taking a look at this problem. Spent a lot of time at homeless camps today. It's a very complicated issue. And so I'm still doing quite a bit of research. Nice to see you all here.
Thank you. Diana?
Diana Noble Gulliford, longtime Federal Way resident.
Thanks. Gordy?
Hi there, I'm Gordy Goodsell. I started with the Federal Way Fire Department in 1983, so I've been around for a while. Both of our kids were born there in Federal Way. And so I'm the Health and Safety Officer with South King Fire and Rescue now, and just here to offer my help in any way I can.
Thanks for being here. Dennis?
Hello, everyone. Good to see you again. My name is Dennis Worsham. I'm the Division Director for the Prevention Division Services within public health, Seattle and King County, and looking forward to the conversation tonight.
Thank you. Jean?
Hi, Jean Burbidge. I'm a former city council member in Federal Way, very involved in the community. Lived in Federal Way for 50 years or so and raised our family here. I'm happy to participate.
Andrew?
My name is Andrew Duane. I live here with my wife. We're putting down roots.
Awesome. Thank you. Sarah?
Hi, good evening. I'm Sarah Glick. I am an epidemiologist and on faculty at the University of Washington. I also work as an epidemiologist at the Public Health Seattle King County HIV STD program. Good to see you all again.
Anna?
Hi, my name is Anna Patrick. I have lived in Federal Way since 1996, and I really enjoy my city, our city, and want to help to make it better to live here. And I too, like Bob Drake, have been doing some research on the impacts of the needle handout in our community. So I'm interested in learning more and having this discussion. Thank you.
Thank you. Joe?
Hi, I'm Joe Daly, the ED clinical supervisor at our hospital in Federal Way, St. Francis.
Nicole?
Hi, I was raised here in Federal Way, and now I'm raising my family here in Federal Way too, with 3 kids.
I have 3 kids. I think that's a perfect number. Cynthia?
Hi, I'm Cynthia Ricks McEltan. I participate in a youth violence initiative program, and I'm also a human services commissioner. Glad to be here.
Thanks for being here. I really appreciate that you all came back and that you're willing to work on this this issue here in Federal Way. So I'd like to introduce Ryan Call. He's our city attorney, and he's just going to recap the legal aspect of this and whatever else he wants to tell us. So go ahead, Ryan.
I'm a little unclear too. I think generally speaking, I think a good place to start is just to understand that the Seattle King County Board of Health is an independent legal entity. It has its own governing body, it has its own statutory authorization to do what it does. So when we're talking about their actions in the city, it's important to know that this is not something that we can most likely directly regulate. This is something that we need to talk to the Board of Health about and negotiate and express our interests and concerns. But ultimately, the decision is going to be made at that board level of the King County Board of Health, the Seattle King County Board of Health. And it's important to keep in mind that council's role is more to persuade them than to direct them to do things. These needle exchange programs have been around for a very long time. They were started, I'm sure you've talked about this last time, but they were started as a way to address AIDS and some of the communicable disease problems in the drug user community. They've been proven effective, and that has been very persuasive with both the state legislature and the state Supreme Court. And so they've ruled repeatedly that cities that contest or question the authority of the Board of Health to do these types of programs, they've been very clear that these are lawful programs. So as we discuss this, it's good to, I think, to focus on expressing our concerns to the board and also to maybe improve the program so it's kind of a win-win, so that the community's concerns can be addressed, but also the health needs of the people that the Board of Health are trying to protect and serve are also addressed. So those are my thoughts. Was there anything more particular that you were looking for, Council President?
No, I just, because we have the public listening in today, I felt it was important to recap what was said last time. Does anyone have any questions of Ryan?
Yeah, this is Dennis. Just the person who was here last time and went over the law as they pertain to it. mentioned the case that was in Spokane, and is what really kind of set the precedence of the law. And from my understanding and in reading that is that it lies within the jurisdiction and the call within public health and a county function and not the Board of Health. So just wanted to put that out there for what I think is clarifying.
The King County Board of Health, I believe, is the entity, but I'm not sure. That case was a different entity. So, but I believe that I believe it's called the Seattle King County Board of Health. Is that correct, Councilmember President Honda?
King County, yeah, King County, Seattle, or
Is it King County, Seattle, or Seattle King County? Someone has to be from the entity here tonight. Who is here?
Dennis is.
I am here.
Okay,
So
what's it called?
Well, we're from the Seattle King County Public Health, and the Board of Health is it's called the Board of Health, and it's a King County governing body called the Board of Health.
Forgive me for confusing the two, but
no problem.
My point is that there is legal authority for you to do what you're doing.
Right.
And
I just wanted to make sure that in your conversation about petitioning the board, it actually is the county.
It goes to the right people. That makes sense.
Correct.
Bob.
Ryan, so I'm gathering from what I heard you say that maybe recommendations and thoughts from this group discussion can be used by the mayor and city officials to negotiate certain protocol that we're seeing a problem with or have seen a problem with in Federal Way?
Certainly the elected officials of the city of Federal Way can express their concerns to them, and how they learn about those concerns are things like this and from citizens speaking up. So negotiate, I mean, that's one way to phrase it, I think, but it's expressing concerns to the board. And I think that, and I keep saying board, what's the proper term, Dennis?
Public health.
Public health. I think public health has expressed an interest in not ignoring the concerns of the citizens. They're trying to find a way to make as many people happy as they can, but still do the job they need to do.
I don't think that we'll be negotiating as people might think of how that word is used, but
yeah,
certainly having a conversation.
Yeah.
I have a question.
Sure.
I read a little bit about the case law that the attorney mentioned at our first meeting, and was surprised to see that it was 30 years ago when we were dealing with the AIDS at the time. And I think at that time, we were still in the middle of this AIDS, not really knowing everything about it and also how to treat it. But now we're in a different kind of epidemic 30 years later, and it doesn't seem to me like it's the same type of mission statement set out 30 years ago, that the clientele is different, that we certainly know more now about drug addiction. And but the part that I see as a citizen here in Federal Way is, how do we help these people and control it, and so that we can put an end to what the homeless and the addiction that we see in our city. Anyway, that's kind of my opinion. Reading that case, that things have changed and turned around, and it when we had the AIDS issue, we didn't have crime associated with the AIDS in our city. Probably a lot of people were fearful, not knowing just exactly how that virus was, transferred from one to another at the time. But this is different because of the drug addiction. We've got outside people coming in, selling their drugs. Plus, we also have crime in our community as a result of it too. So my thoughts are, my opinion is, I don't want to isolate our solution to just stay within the scope of the court ruling and the scope of the health department. Thank you.
Thank you, Diana. Any other comments? Thank you, Ryan. Are you going to stay on the call, Ryan?
I actually have another ordinance to write, so I need to check out if that's okay.
Okay, thank you.
Thank you.
All right. Joe, would you like to talk about St. Francis ER and what you're seeing there that might be helpful to this committee?
Sure. So again, I work at St. Francis in the emergency department. I've been there for about 5 years. So what I have here is a little piece of data. Last month in March, we saw about 3,500 to 3,600 patients, and 146 of them had come in and received a substance abuse diagnosis. And so that's kind of broad, a little bit broader than, injection only, but it's going to include alcohol, meth, heroin, everything. That was 4% of our 4% of our total patients. And so I guess, that's not an insignificant, patient population. A lot of these patients that we see are, homeless. I think what did we call it? Something unstable.
Housing instability.
Yes. They suffer from housing instability. That's, by far and large most of our substance abuse people. And then, just personally working in the department, people come in for all different kinds of ailments, not necessarily a substance abuse issue. They may have issues, health-related problems related to drug abuse. For instance, abscesses are extremely common, and I would say are probably, almost more frequent of a reason that we see people in the emergency department than like an overdose. So that's also very prevalent. We do have a chemical dependence counselor. His name's Pete Staples, and he sees about 40 to 50 people a month in our hospital. He just will, audit charts of people that are in the department real time and make contact with them and try to get them different services. A lot of the times he's there to just start a relationship, and he'll get shut down quite a bit more often than not. But it may not be the first, second, or third time that he, actually gets to have a conversation with them, but he's pretty persistent. And I think he actually operates through a grant from the King County Public Health. Just a few experiences. I've given Narcan in the emergency department and saved people's lives. We've put them on Narcan drips. And one thing a lot of people don't know about Narcan, it can actually, if someone is not trained and educated in the delivery of that medication, it can actually be kind of dangerous. So I am dad tonight. My wife is at work, and I'm gonna have to put you on mute for just 1 second. Why don't you come back to me?
Okay, thanks. All right, well, that happens so often with being at home on Zoom. So why don't we, at this point, go ahead and have Dennis and Sarah present any information that they might, or any data or that they might have to share with us tonight, or answer any questions that the committee members have.
Susan, just I want to clarify. So I think we're prepared to kind of walk through some of the same slides we did last time and respond to some of the questions that came up last time as well. Just wanted to, because I think that was kind of the agreement of the committee, knowing that we were going to open this up to people externally to be able to watch, and we thought it was important for them to all have the same information. So that's what we're prepared to do. Just wanted to make sure everybody was reminding them, and Sarah's going to kick us off this time, and then I'll follow her.
Thanks, Dennis. Can everybody see my slide?
Yes.
Okay, great, thank you. So yes, all of you on the Zoom screen here did see a lot of this last week, so you'll all be pros by the time that we're through this, but I think we've added some new things in. As Dennis mentioned, we took the questions that we received from this group back to our colleagues and asked them to help us get some answers. So we can go through those as well in a little bit. So I'm again just going to kind of rest on this slide and walk us through this. Again, my goal is really to talk about what the research has shown regarding syringe services programs or needle exchange, and then Dennis is going to talk specifically about the King County programs. And just again, for those of you watching at home for the first time, I do want to talk a little bit about terminology. As you'll see on the screen, I use the phrase syringe services program, and I think it's relevant to talk about this because this is very much tied to some of the concerns that have been brought up and shows that our programs offer more than just syringes. So needle exchange is the phrase that's been around the longest. It's what people recognize. Sometimes we talk about the actual facility itself as the exchange, but the term syringe services program, or SSP, is what is used more formally. It's what CDC uses, and that's because it more accurately describes the full comprehensive nature of these programs. Syringe access and exchange are usually the primary activities, but SSPs provide a lot of other services like overdose prevention, HIV testing, linkage to treatment. As the city attorney mentioned earlier, SSPs are an example of evidence-based public health practice. And what that means is that we have now almost 30 or more years of data showing that they've been effective. So I want to talk about each of these goals, and I'm going to spend the most time talking about HIV, since that is the primary goal, or preventing HIV is the primary goal of SSPs. Just a little bit of history. Needle exchanges, as they were known then, were initially launched in the 80s in response to the AIDS crisis. HIV was increasing in several populations, including people who inject drugs. And people who worked with this population just knew that it made intuitive sense to limit the way that, in order to limit the way that people spread HIV, was to provide them with sterile or clean syringes. And so the goal here is to minimize or hopefully eliminate syringe sharing. If people use a clean needle for each injection, this will reduce the spread of HIV. So the first sanctioned SSP was actually just down the road from us in Tacoma. And the Seattle program was the second program in the country. So in the Pacific Northwest, we have a long history of SSPs, and we think that this is probably one of the main reasons that we've maintained for 30 years the low prevalence of HIV that we have. And so right now we estimate that our prevalence is probably somewhere between, the HIV prevalence is somewhere between 1 to 4%. So 1 to 4% of people who inject drugs, we think, are living with HIV in King County. There have been really strong studies showing that people who use SSPs are at lower risk for HIV. And these have been done by following people who inject drugs over time and comparing the risk of HIV in the group who uses SSPs and the risk of HIV in the group who doesn't use SSPs. And we've found consistently that HIV risk is much lower in the group that uses SSPs. And since then, though, there's been a lot of other research, and that research has consistently shown that SSPs reduce the risk of other things like hepatitis C and overdose. And that's because SSPs, as we've already started talking about tonight, are one of the primary places where people who use drugs, as well as their family and their friends and their loved ones, can obtain naloxone or Narcan. And as the nurse mentioned earlier, naloxone or Narcan is the medication that can reverse the effect of an opioid overdose. So moving on to the second major finding here, research has consistently shown that SSPs link people who use drugs to other services. And so this can range from primary health care to mental health care, reproductive health care. It can also include treatment for HIV and hepatitis C. And I know we talked about this quite a bit last week, but SSPs have also been the focus of a lot of effort to link people to substance use treatment. And that can, run the full gamut as well, from detox to methadone to buprenorphine. And for those of you who aren't familiar, methadone and buprenorphine are daily medications that people can use to reduce opioid use. So but my predecessor, who had my position before me, conducted a study in Seattle, probably now a decade or two ago, and found that people who used SSPs in the Seattle area were 5 times more likely to enter drug treatment than people who had never used an SSP. Last week, there were some questions about our data around this, and so Dennis is going to show you an updated estimate. But we looked at some survey data that we've conducted and found that over half of our clients reported that they had had some drug treatment in the past year. And so that's different from that estimate we showed you last week, which focused on a very specific subset of people who had been linked to certain programs by our social worker. When we look more broadly, we see that half of our participants have accessed treatment in some way. And so it's a really high number. So we'll get back to that once Dennis gets into his presentation. Also, people who use drugs don't access a lot of typical services. Like you and I might go to our annual physical or something like that. As the nurse was saying, a lot of people seek services in the emergency department. And really, other than that, SSPs are probably one of the primary places that people who use drugs routinely access services. And so those services have this built-in trust, and it's where a person can go once they're ready, if they're ready to seek treatment. So the third bullet point I wanted to talk about tonight is that SSPs have been shown in research to not increase drug use, and they don't increase crime in a community. They actually reduce drug use. And so that same Seattle study I mentioned before also found that people who were regular SSP users were 3 times more likely to reduce how frequently they were using drugs. And there have been other studies that have shown that crime rates don't change before and after an SSP opens. So you might think, oh, it'll increase crime, but in fact, the presence of a syringe services program has been shown to not actually change the crime rate in that area. Fourth, one of the services that SSPs provide is safe syringe disposal. And there have been several studies that show that the areas around SSPs have less syringe litter once they're open. And so this is typically done by conducting what we call a litter survey. And you can do that before a program opens, and then you can do it again after a program opens and compare what you find between the 2 surveys. And it's been shown that syringe litter decreases after a program opens because it's a place to dispose syringes. And then finally, I wanted to talk for a minute about one of, the CDC's key recommendations for SSPs. And the CDC recommends something that's called a needs-based model for syringe access. And what that means is that participants should be able to receive the number of syringes that they need when they come to a program. And this is different from more restrictive models. The most restrictive model is something called a 1-for-1. And with the 1-for-1 model, clients only receive the new syringes based on the number of used ones that they bring in. So because a needs-based model typically provides more clients with more syringes, this reduces their need to share syringes. And so what that means is that needs-based models are associated with lower HIV risk, which again is the main purpose of a syringe services program. With that, other studies have shown that needs-based models do not lead to more unsafe disposal. They are not associated with a higher likelihood of improper disposal. And so I do want to be clear, we've talked with staff at our program, that clients, even in a program that is not 1-for-1, they are still encouraged and they do return a lot of their syringes. I've actually led focus groups with people who inject drugs. We've talked specifically about syringe disposal. People that we talk to want to keep their community safe. They want to keep people safe. They want to keep where they live, their own cities and towns. They want to keep those communities clean. And they want safe disposal options, which includes SSPs. And so I just want us to be sure we keep that in mind, that people are returning their syringes and they want more options to be able to dispose of them. And then finally, what I don't have on here, but I just wanted to talk about for a second, because it's so recent and is a pretty profound thing that's going on right now, is really coming back to this idea of HIV prevention. And there is a current situation going on right now in the state of West Virginia. Over the past few years, they have had a large HIV outbreak among people who inject drugs. It's one of the biggest in the country. It's in a county called Cabell County. And the outbreak was actually identified just a few months after the county put initial restrictions on its SSP. And then in the past week, really since we've last met, the state passed a law that even more severely limited SSP services. And they're limited to the point where a lot of people think that the programs are going to have to close. And this is exactly the opposite of what is needed right now to stop their HIV outbreak. It is not going to stop people from injecting drugs. It's only going to make them less safe, and it's going to spread HIV throughout their whole community. And so I really want us to keep that in mind and think about the potential ramifications of doing that, which is what has happened in West Virginia. So with that, I am going to turn this over to Dennis now so he can talk more specifically about our program, what its goals are, what its services are, and some data to support what our team has been doing over the past 30 years now. So Dennis, I'll control the slides and turn it over to you.
See if I can get myself off of mute as well. Sarah, thank you as always. Really appreciate your work in this field and the contributions that you make. So thank you. Also, just really appreciated the open conversation at the beginning of the meeting. I think it's helpful to know where people are at and what their concerns are, and to get to a solution that is in a way moves us forward, but at the same time protecting the health and well-being of people who live in Federal Way. The services that we do provide for in our SCORE van that come to the Federal Way area are serving people who live in your community and are from your community. And we do want to keep them safe and your community safe as well. And that's really what drives behind this program very much. So as this is somewhat a little bit repetitive because it's been brought up a couple times already, but just wanted to remind folks that add a little bit more context to it as well, is as the AIDS epidemic was rolling out in the 80s and 90s, there was an activist group called ACT UP, and was demanding services for the government to step in and really try to address the outbreak of the AIDS epidemic that was going on at the time. And as Sarah mentioned, the first one in the United States was in Tacoma, and the second was in Seattle, King County. And after the Group Act Up demanded these services, the public health department and the governments said that they would begin these, and they would be under a government watch to make sure that they were implemented in a way that was both effective but also controlled. And 32 years later, there's, as Sarah has gone through nicely, a lot of data that really shows the effectiveness of the program. I just, want to pause and just appreciate the data point is that we're in a very different place in our AIDS epidemic in this coast with people who inject drugs than anywhere else in the country. And this is primarily because of our initial adoption into these SSPs in order to be able to cause a difference. And 1 to 4% is extremely low in comparison to the example that Sarah just gave that's going on in West Virginia right now. So just it's a highly effective, the data shows that, and several points have been made on that already. The question sometimes comes in about how are these programs funded? In the system in which we receive funding in public health as a governmental public health system, we do receive money from the Center for Disease Control, which is the federal health department, if you will, and then comes through the local health department, or at the state level called the Department of Health at the Washington State Department of Health, and then both the city of Seattle and King County, in which we provide our services through the public health department, serve the entire county. So we are, although we're called Seattle and King County Public Health, we're every jurisdiction's local public health, including Federal Way. So we are funded, but primarily through these mechanisms in order to provide these services. Also, just wanted to give a little bit of sense of where we operate our services. We have 2 fixed sites in Seattle, one in the downtown area, one up on Capitol Hill area. And then we provide additional services through our mobile services, van services, both on the north end and the south end. And of course, you're familiar with the south end services, oftentimes referred to as the SCORE program, coming down into the south part of the county and into Federal Way specifically. Next slide there. The other epidemic that's going on, other than when we talk about HIV as being an epidemic that in particular that was so heavy in the 80s and 90s, we have another epidemic that is really hitting us very hard. And that's really around opioid overdoses. And in the last 12 months, more than 87,000 Americans have died of drug overdoses. And that's greater than any year since the epidemic began in the 1990s. So we have an increasing problem around drug use and overdoses that have plagued our country and our community. And of course, in King County, we see that very same thing here as well. 116 people, according to our data here in the county, people have died of drug overdose, and an additional 42 have probable causes that are linked to drug use as well. So that's just since our first quarter of 2021. These numbers continue to increase over time, and is a real concern. In Federal Way, in 2020, our EMS agencies responded to over 90 suspected non-fatal overdoses, and 24 specifically in Federal Way residents died following a drug overdose. Some of the question, there was a question last time in particular about EMS services and the data that is collected there. There's a part of the King County website is a great interactive site we can put in the chat to the EMS data on non-fatal overdoses. But a couple things I took a look at that based on the question last time, and just looking at Federal Way specifically, when you can look at the county and then you can get into different areas of the county and specifically into communities. And at the county level, there were about 100, we rest between on the EMS response to non-fatal overdoses is somewhere between about 160 and 200 per week. and in Federal Way as high as 11 in 1 week in the month of March, and the rest of the weeks hover around 4 to 5 per week. So it is a thing that we're seeing in your local community as well, is our EMS services and responses to our overdose situation. Next slide. So a little bit about our services that we provide through public health, and our intent, as mentioned earlier, is really our goal is to provide low barrier services in order for people to access these. Our goal in public health is to stop the transmission of disease from one person to another and ensure the health of an individual. And so we do that trying to bring these services and meeting people where they're at in order to get those services to them. And again, it's something that from a public health perspective, we care and have the humanity of the individual in front of us at the time, but also knowing that there's a transmission that happens because this is a communicable disease and can be transmitted from one person to another. It's an intervention that is also in place to protect the community and people they care about, and it's important for us to meet people where they're at and providing those services. A couple things that we provide, and Sarah alluded to or mentioned most of these already, but we do provide the actual syringe exchange for people coming in, and it's make sure that they have clean, accessible works in order to protect them. And we want to make sure that that they have what they need in order to inject safely, and encourage that single-use sterile injection equipment every time. We also encourage, and we see as a result of that, we have a great response for people who we exchange with, bring their sharps containers back to us, and we do take those back and we dispose of those for individuals with the idea that to get them out of the community and dispose of them in a very safe way. We also do provide other harm reduction supplies. Again, that this is a bloodborne pathogen, and want to make sure that all their works and supplies are sterile and safe for them to use, and to prevent the transmission of both hepatitis C and HIV. We provide a lot of education, referrals to drug treatments. Sarah mentioned that earlier. I think you saw in some of the slides and information we presented last time that there were 76 referrals that were made specifically from our social workers to publicly funded treatment slots. That is only counting those that are direct social worker provided for individuals. But the important thing is that we know that over 50% of people who access our services and through surveys have actually entered some level of treatment in the past year. So we do know that the links to our Ssps also is a link to treatment and to people who are trying to change their habits or trying to be in a different place. And we help to leverage those services by doing that work. Another thing we've talked about already, both by the nurse earlier and by Sarah, is the naloxone training and distribution. Is we do like to have folks understand how to train them in how to use naloxone, and actually to do the reversals when there are actual overdoses in the people that have it. We feel it's best for people who are injecting with others or in a community that they know how to best serve their peers and the people that they care about as well. So it's important for family members in law enforcement oftentimes have these, as well as individuals who we provide those services to. Again, really looking at holistically and what we provide for individuals. We also try to link them to other medical practices. Again, the comments that were made by people who come into the ER as one of those services by the nurse in the opening comments. We do in our downtown site, we are linked to a public health center that provides medical services that we contract out with the UW Pioneer Square and provide kind of holistic medicine services in those particular areas for individuals who need that. So we try to see from a perspective of meeting people where they're at, providing the services that they need. We do things from HIV screenings to hepatitis A, B, and C screenings, syphilis screenings. We get them vaccinated for vaccine preventable diseases. We provide education. We provide them to linkages to care services and care, and then naloxone training, and to really address people where they're at, to keep them safe and to a place where they're at currently, and to help them facilitate a place where they want to be if they want to have a behavior change, that we develop those relationships with folks in order to be able to help them get there. And I think having trusted relationships often comes with time, and the good staff that we have that are out meeting people every day are building those relationships and helping to foster better health in your community. So I'll stop there and open it up for questions. Oh, I'm sorry. These are a couple of the service. Thank you, Sarah. A couple of the service points that we have seen from the services that I've just mentioned in the first area, that to kind of reiterate some of the work that we are doing in the actual work of reaching out through our sites and through our partners that we work with. We've seen 5 million syringes through our fixed sites and our mobile sites here in King County. And we've had 19,000 exchange encounters with individuals. I think this question came up last time about encounters, is we don't take names of individuals. So those encounters can be multiple visits. But they are counted as an encounter every time we do meet with somebody and have an exchange for them. There were 778 medical clinic patients, people we referred to medical services. And this number that has been mentioned a couple times, 52% of our needle exchange clients received treatment in the past year, and 130 clients received social work services. We do have a social worker on staff and try to look at the holistic and the whole health of an individual and get them linked to some of those things that are important to them. In our work when we talk in public health, we also talk about looking at social determinants of health, social conditions in which also have impacts in health. And our social worker really helps facilitate, again, kind of this whole health approach. About 2,756 customers were trained in how to reverse opioid overdoses through naloxone, and reported of those that we have provided those naloxone cases to, we were actually able to document 448 overdose reversals as part of that work. So a good set of numbers here that show the importance of getting the needles in the community, bringing needles back in, and getting them safely disposed of, getting people to treatment, and saving lives of people with overdoses as well. All right, I will turn it back to you, Susan.
Thank you. So, oh, Joe's back. Joe, did you have anything else you wanted to add?
Yeah, sorry about that, guys.
No
I think I was just talking about my personal experiences in the ER, delivering Narcan and naloxone. I think I was just saying that, I think it's a medication that's best delivered by somebody that's trained, because when you administer Narcan or naloxone, basically you're knocking off all of the opioid receptors, that drug off of the receptors, and they instantly come out of, all their high, all of, they feel incredibly extreme amount of pain, and they can be very upset at the person that did that. And so again, I was just trying to emphasize the training portion of that. I think is pretty important. And then, any amount of services that this population can get before they get to the ER, I think is extremely beneficial, because they do tend to be frequent and high utilizers of emergency services. as their primary care. And that's a really inefficient use of the emergency room's time. But I mean, we're there. We care for anybody that comes to the door. I don't know. That's about it.
Thank you. Thanks. All right. So now is time for questions and answers. So who has questions about the program and about the program in Federal Way?
I have several questions.
Okay.
So for Dennis, I was wondering how many dollars, both state and federal, are spent on treatment, and what facilities that the referrals, so what treatment facilities are the referrals referred to, both for detox and treatment? And then I have a couple questions for Sarah. What are the crime studies you cited this week and last week, and as far as no crime increase? I'm curious about that because we've seen what seems to be a major uptick in crime here. So I'm wondering what study. I see the slide that says there's no increase in crime, but I would like to know specifically what study might be involved, or what study you're quoting there. I'd also, Sarah, wanted to know how can we increase collection of syringes? We're finding a lot of collateral damage with syringes all over our city, and whereas that might be a normal fallout to having a syringe program like this, how could we increase the collection of syringes in our city? And then finally, for Joe, I was wondering what the nearest to your location, what the nearest detox center is. Thank you.
I can start. I probably, Bob, will have to get back with you with a lot of specifics. I'm not on the treatment side. I'm on the public health side, but we do make the referrals into a number of programs, methadone programs that are situated through Evergreen. We do have some therapeutic health services through Pathways that we fund through public health. We work closely with our partners, agencies who fund treatment centers and get referrals into those particular areas. But I can get you a list. I can provide a list back to Susan of the number of treatment centers and facilities within King County. And the funding part, again, it's not done by public health. It's through a different agency in which funds treatment centers. We don't run treatment centers through public health. So I'll have to call a friend on on a sister agency in order to get those dollars.
Thanks for those questions, Bob. So I have the two, I would say, best references for the crime studies. I will, most of those articles they're behind a paywall to the public, but I can download them through my UW account, and I will send them to Susan to share with the full group. So I'm happy to share those with you. And to your second question, how can we increase the collection of syringes? It's a good question. What we have heard about in focus groups, but also what others have learned through this same question coming up in other jurisdictions is really to just increase the options and opportunities that people have for safe disposal. So that can take a couple of different looks. It can be more public sharps containers. So those could be larger containers that are available in public areas where there's known to be maybe more syringe disposal or more folks who would be able to dispose of their syringes there. Those need to be serviced regularly. So they can't just be a one and done thing. They do need to be staffed and serviced. And, along with that, I've talked with people who are in communities where there has been concern about syringe litter, and they have actually partnered with people who perhaps live in encampments or are people from, who use drugs themselves, and pay them to provide, a job to help clean litter. And so that is an option where you're both then providing support to people to help them perhaps get out of their circumstance and also cleaning litter at the same time. So that's another option. But primarily providing more options for syringe disposal is going to be better.
Can I follow up with a question, Sarah?
Sure.
So I know that we're putting quite a few dollars into the syringe program and into the surrounding services involved with that. Can you tell me if there are King County dollars devoted to cities who are impacted by the cleanup associated or that can be associated with the program?
I don't know the answer to that. I would have to go back. I don't know if Dennis, if you know the answer to that.
Yeah, not that I'm aware of.
I will ask. I do know that there are some public syringe disposal options out there, including in Federal Way, that already exist.
Sarah, where are they in Federal Way? Do you know?
Oh, let's see.
I believe there's one through the Public Health Center in Federal Way is one spot for sure. I don't know if the city has any that you're aware of, Susan, but that are operated or maintained by the city.
Well, I know that the day center has, at least at one time, I haven't been in there for over a year. They did have a syringe collection box in their restrooms for the women and men. But the city doesn't run that program, but I know that was available.
Yeah, and just
I'll have to look into that.
Yeah, and Bob, I know that this wasn't directly your question, but just a reminder that when we do hand out our syringe services, we do hand out also sharps container boxes for folks, and that's what they return them in as well. So we do a handoff individually to folks as they access our services, so that they do have a safe place to be able to get rid of them, and then they bring them back to us, and then we dispose of them.
We do have some at, it's been controversial, but at the libraries, they have them in the bathrooms and they are serviced regularly. They are also at some of our pharmacies have them, and most of the urgent care facilities here. So UW Urgent Care, Virginia Mason Franciscan Health Urgent Care. There's a couple other urgent cares here. They have the receptacles as well, and they're regularly serviced.
Thank
and the
you,
libraries
Cynthia.
have been closed for over a year, so that could be part of what we're seeing now.
Right.
So I guess my request would be in regards to this, Sarah and Dennis, is that I'd like to see an increase of these locations, because I spoke with a lot of business today, and I have hundreds of pictures of these needles all over the place. So I'm trying to look for solutions, and I think we need more containers within our city to help with this problem. And I would work with you in any way I could, because I have a lot of extra time now to figure out a way to do this. We need more opportunity for these needles. They're all over our community.
Right. We have that same, from a public health perspective, we have that same concern, right? We don't want dirty needles out in the community. So we share that goal with you, Bob.
Okay, and Joe, you had a question for Joe?
Yeah, I believe, Bob, you want to know about the closest detox facility. So I'm not exactly sure. I know that Valley Cities is a pretty big mental health provider in Federal Way that does offer substance abuse counseling and services. I don't think they're an inpatient hospital, however. There's a massive shortage of mental health and substance abuse beds, certainly in our area. I know that we will send people as far as Everett and Marysville for treatment for those things. But to answer your question specifically, I'd have to, probably go back to Pete, our chemical dependence counselor, or our social workers in our department and find out what the closest one is.
Thank you. All right, Anna, your hand was up next.
Okay, so my question, first of all, Bob, I'm glad that you asked for some of the data. I would also like to see some of the cited data of the effectiveness of the program, of the needle exchange program. Because, can you hear me okay?
This is better
Okay,
now.
is that better? Sorry, I just
Yeah.
realized I had my microphone above my. Okay, so I would like to see. I don't want to just hear that the data suggests it. I would like to. I would just like to see the. I want to see the actual data. I want to see the research. I want to know how the study was designed. I want to know all the details, because so often we hear data driven and research based, and it feels like a sales pitch. I want to see. You're gonna have to prove it to me that this is really needed and necessary, because right now what I'm seeing is I'm seeing a flood of drug addicts coming into our community, and I think we need to take a more holistic approach and look at this, not just zeroing in on the addict and how we can make them more comfortable doing what they do and meeting them where they're at, but we need to figure out what the goal is, and that for me is getting them out of that lifestyle. And I would hope that most other people would agree, but I kind of feel like sometimes the impression is that King County is kind of wanting to keep people where they're at, and everything is revolving around this lifestyle, and it's toxic to our community. We have families, children. It's toxic to families. It's tearing families apart. How much money are we going to pour on this? How much money are we going to pour on keeping them clean versus getting, how much money are we going to pour on keeping them from getting addicted, keeping them from harm versus getting them clean? And I want to know from a holistic perspective, because you're connected to King County, how much money are we pouring into it as a community? I want to look at all the data. I want to start collecting data, because what I'm hearing is that there really isn't a lot of very specific data. We've got some general numbers. We've handed out this many needles. We've got this many people into treatment. I want to know who, what, where, when, why. Where do they go to treatment? What's the program that you're offering? How long did they stay? I need to be convinced that this is something that we need here in Federal Way. And until I'm convinced, I want it out of here. And I know that's not an option, but I'm going to be asking that we really have some higher expectations here in the city of Federal Way versus what I've been seeing elsewhere in King County. I just want to say that. So I do have a lot of questions, Susan, and I don't know, it's more questions than we can cover here. So what I'm hoping is that I can maybe submit some of these questions later, just so that I'm not wasting all this time. I've got a huge list of questions. So I want to get information about this. And so that's all I'm going to say. Thank you.
Okay. Yeah, please send your questions in so that we can get you the answers.
So I want to go a different route, because I really want to talk about the goal. We started out with two goals. Number one was to address public health, infection rates, right? We wanted to decrease infection rates, HIV, AIDS, and hepatitis C, and other infections, right? That was one goal. The second one was to connect people to resources, right? So if those are the two primary goals, the question is this program working for that? And I think our job here is to determine if this is if this program is in fact working to do that, and if not, what is the alternative? Before you take something away, please show me what's out there and what could be done better, right? So let's talk about the elephant in the room, COVID. It's out there. People are getting it. People are dying from it. We now have vaccines. We're trying to get people vaccinated for those that can, and hopefully more will want to be vaccinated so that we could spread that. So we can slow down the rate of COVID. What about other diseases that are out there? If we take this away or try to restrict it, will we end up with, was it West Virginia that you mentioned? Will we end up like that, where we will see more people going to our ED departments and dying of overdose and see an increase in HIV/AIDS? I think it's quite interesting that when you look at programs across the country that have syringe services programs that have way more restrictions, their infection rates among HIV/AIDS and hepatitis C and other areas are higher than those communities like ours, where we have a different model that encourages people to come in to build that relationship. I asked this question last time, and I'm going to ask it again. What's the data, or do we have any, about how many interactions you have to have with someone before you are in a position where you could discuss treatment? That's very important. Because we have to build the trust. And any of you who've ever dealt with an addict, you ever gone through Alcohol Anonymous or anything like that? You have to recognize that you have a disorder, that you have a problem. And you have to want to get help. And in order for that to happen, you have to have interactions with people and build the trust to help bring you around that says, I'm ready. So again, what's the average number of interactions? What's the range of interactions that typically a person must have before they're even open to looking at treatments and discussing those kinds of options?
Dennis, do you know that answer?
Well, it's a complicated answer, right? If you look, I mean, how long does it take you to trust somebody? You know, and everybody would probably have a different answer here in this group. You know, I don't know every person's situation, but I will tell you from a personal experience that people oftentimes who have either mental health or drug addictions also have some level of trauma in their life, right? There's something that has happened to them from their childhood to their adulthood piece that happens. And every individual is different. And depending on what their past experience is, it's also going to take time to build that trust. You know, think about family members. I know there were some of you who were open enough to share in our last meeting about your own family members. And we love and we care about our family members. I have a niece who was addicted to heroin, and I have a trusted relationship with her, and it took a long time to get her into treatment. And it isn't just a one and done type of deal. And so, but it's the constant interaction, it's the constant humanity you show up with these individuals that changes behavior. And, you know, it's one thing that this team does very well is they show up in the humanity of these individuals who are struggling in their life. We're trying to keep them alive, and we're trying to keep them out of disease so that when they do become sober in their life and do come over their addiction, they don't have a chronic disease like HIV that they contend with for the rest of their life. So our job is to keep them healthy and whole, And sometimes that trust takes longer because there could be a number of abuses that have happened in their life. So it's not an easy answer to say 1 or 2 times of an interaction. We think about our own behavior changes and how difficult they are. And this one has a chemical dependency that's stronger than other addictions. So it's a tough way to answer it.
Thank you. Anything else, Cynthia?
I appreciate that, and thank you, Dennis. So, if I assume that the people who are in the mobile are usually the same team servicing the same area, so that there's a familiarity amongst the team that's there in the communities that they reach out to. So if I happen to be a newbie coming up to a mobile van, how likely is it that the team is going to try to engage me right then when I come up and I ask for some needles or whatever I ask for?
I don't know, Dennis, do you want me to take that, or do you want to take
Yeah,
that?
go ahead, Sarah.
Yeah, so Cynthia, that's a great question. It is generally the same team. So there is a schedule that stays pretty consistent. So if it's a Tuesday, it's likely going to be the Tuesday team. And there just are certain people that tend to work those shifts. So yes, there is a consistent team that is showing up on the same days.
Yeah, I will also say, just from in a leadership position over the division, we also have longevity in this program. It's not a program that we see a lot of turnover in. So the people who come to do this work are dedicated, and they generally stick with it. So they're pretty known in their community in which they serve.
Thank you.
And are they trained in trauma-informed care and practices?
Yeah, Cynthia, we took on a project within King County through a grant we received a few years ago in really becoming a trauma-informed health department. And this team in particular already probably were way far ahead of the department in that work. But given the history of the people that they serve and the clients that they serve, they're very well versed in that. That's why we say we meet people where they're at. It's the first step in a trauma-informed practice.
All right. Thank you, Cynthia. Nicole, you had your hand up and then you took it down. Would you like to, you were the next one I was going to call on.
Oh, so my question was, most of the concerns that I am seeing from people that have read the articles about what's going on in Federal Way and have concerns about the SCORE program were that it was that about 100 syringes were being given away at a time to people. And I understand, if I understand this correctly, it was because of COVID. Do we have a plan to get it back to the regular distribution level based on COVID numbers, or like what's the goal there?
I can start, and maybe Sarah will want to add on a little bit. So this is something we've been looking at as a department. But because, let me start with COVID. As COVID came into place, and of course, we are trying to limit interactions and risk exposure, both for our staff and for the people in the community, so that we don't spread COVID among our communities, trying to keep those rates down as best we can. Highly infectious, as we all know, and learn every day in the media. And so made a decision, again, from a harm reduction perspective in a public health approach, we felt that this was a vital service to our community members, because if we were to stop it, we were concerned about what would happen with the other disease rates within our community. And so we took a mitigation strategy, and in that mitigation strategy was to have fewer encounters and exchange more needles at a time. We've been doing that. I will say I would think it's going well. And the other part that I would connect to that is part of what Sarah has gone through in the CDC, our Center for Disease Control, federal government has come out and said, for SSPs is the most effective way in doing this work is need-based rather than to be more restrictive. So Sarah, I don't know if you want to add anything from the research on that.
Yeah, the thing I would add is that the CDC recommendation for needs-based was actually published in September of 2020. And so it was published mid-COVID. And I know it was something they've been working on for quite some time. But as you can imagine, getting the federal government to get to this point took a while. And so at this point, we are following CDC recommendations. And so returning to a more restrictive model would be going against CDC recommendations.
Nicole, do you have any? Is that it? Okay. Andrew, your hand was up next.
Thanks. I just had some comments about some of the questions that I'm hearing. It sounds like a lot of the concern is related to cost. And, I know that, we've seen, just based on the past experiences in West Virginia and also in 2015 in Indiana, that, the absence of these programs do cause hepatitis and HIV outbreaks. And given that fact that these things, that making these programs more restrictive can cause those outbreaks or worsen in progress outbreaks, I guess I just want to ask us to think about what would the cost be of not having this program. Preventative care typically, or maybe even just as a rule, is always going to be cheaper monetarily than actually solving the problems that the prevention could have caused. So, as Joe mentioned, if people are coming into the ER because they're overdosing, because they don't have access to the medication needed to reverse the overdose, you're going to pay for that as well. Only I think that it's going to come with a higher price tag just by nature of coming through the ER. And so I guess I personally don't think that it's right to think about this financially. If the goal is to save human lives, whatever, tax me more, right? I'm not interested in the financial aspect. Let's just help people. But if you are concerned about the financial aspect, I just wonder, if we do save money on this, how much is it going to cost us?
Dennis or Sarah?
Can I just say one thing to that point, Andrew? I appreciate that very much. If we do want to talk dollar signs, I was talking with a colleague at CDC this week, and she told me that with the HIV outbreak alone in Scott County, Indiana, it's costing over $1 million, over $100 million in lifetime costs just for treating HIV attributable to that outbreak. This is a county of 25,000 people, and it is going to cost $100 million to treat folks for the rest of their lives. So thank you I really appreciate that.
Do you have any other questions, Andrew?
No.
Okay,
really.
Thank you. So Casey's hand was up next, and then Jean. And I'm sorry I didn't have you introduce yourself. I didn't see you in a box.
That's all right. Casey Jones. I'm with the police department here, and I'm also a city resident. My two questions are: when did the SCORE thing start in Federal Way, and what locations have you guys been using?
Sorry, I couldn't get off my mute. I need to, Sarah, do you know the actual date that the SCORE started?
I don't know it off the top of my head, but I can try to look it up.
We'll get that for you in just a second. We'll get it before the meeting's out. And what was your second part of the question? I'm sorry.
Are you guys using constant locations?
Oh, I see.
Around, or what locations do you find the most, most people, or what the most effective for you guys, that kind of thing?
Yeah, so what we have for the mobile vans is we have a phone number people call, and we make an arrangement to meet them somewhere in a public place in order to be able to do an exchange. We do stay away from schools and parks and libraries and places where children may be, and we try to stay out of the public eye because we know people aren't comfortable with people who inject drugs and syringe services. So we try to be discreet, but it is a appointment base that people call and let us know, and then we meet them somewhere in order to be able to provide those services.
And it could be commercial or residential, but you're saying you stay away from schools.
Yeah, we stay away. There's a list of places we stay away: schools, libraries, parks, and a variety of places like that.
Thank you.
In Casey, it was 2009 when the SCORE van started.
Thank you. Are there any statistics on the number of syringes exchanged from SCORE specifically, or is the program discounted as a whole?
We do have, I don't have I can get you the number of how many that SCORE exchanges specifically. Let me get that number for you. I'll look that up real quick. And I will tell you that of all of our sites that I mentioned, the 2 fixed sites, then the mobile, both north and south, SCORE is our second highest area for syringe exchanges.
Thank you.
Is that, Casey, is that just SCORE in Federal Way or SCORE in South King County total?
I'd be curious about the ones in Federal Way only.
I'll see if we can get it to Federal Way specific, but the way that I had seen the data originally was through SCORE through South County of when they go out, but I'll see if we can get it by city location.
Yeah, I'm not sure
Thank
it's possible, but we can ask.
Thank you.
Thank you.
Jean. You're muted.
There we go. Okay, I'm
Thanks.
sorry.
No problem.
Cynthia and Dennis made really important points about the process involved in getting to the point of people asking for treatment, being ready to seek out treatment. And perhaps this takes us beyond the immediate goals of this particular effort. But according to Joe, there is a significant lack of mental health and drug treatment programs in Federal Way and South King County. And I'd be very interested in being provided with how this area compares with other parts of King County specifically with those resources.
Yeah, one thing I would say, I think that's a really good point. You know, I know in our last conversation last week, there was a lot of interest around treatment and where people can go and costs and access and all of those type of things. Susan, it might be worthwhile for this group is actually to bring somebody in on the treatment side and provide some information for treatment who are more versed in that than Sarah and I. Our role is a bit different in what we facilitate. We're a linkage to that care, but we're not the actual providers of that care. So I do think it's important part of the conversation in the equation. We do know that there are, it's not as robust as we'd like to see in our society.
Thank you.
Anything else? Anything else, Jean?
That's it for now. Thank you.
Okay. Before I call on Bob, for anyone who hasn't spoken, do you want to ask a question or? Nope. Okay, go ahead, Bob.
Dennis, I can sympathize with some of your words here today. My son is a heroin addict, my oldest son. My personal feeling here is I was invited here for an opinion in a work group. We need a more treatment-based system, in my opinion. Beds and detoxes seem to be full. I'm just going to make a recommendation that we need to look at that you're providing an outreach service with these syringes and other services associated with it. Why can't we look at having trained professionals? I know we're doing some training with the people in the van, but why can't we need to move people to treatment in order to get out of this nightmare. The supplying them with needles, I see what the objective is to reduce disease, but it's impacting the community. And I would like to see more treatment options and professionals in these vans that can help facilitate. That's what they do for a living. They're going to help facilitate the move to treatment. That's their wheelhouse. Why can't we put some people, train some people, and this is what the service they can offer. This is their specialty. And if we're not doing that, we need to look at doing that for the future of this program.
Yeah, thank you, Bob, and also thank you for being willing to share about your own son. I agree. I think treatment is a really important equation to this. Of course, you know, if we could get if everybody was ready and willing to go to treatment, there wouldn't be a need for this service, nor would also bring down our disease rates. But of course, not everybody's in that place right now. I do think, and I don't have a comparison to other SSPs across the country, but I do want to, you know, say back that 52% of our folks have been into treatment within the last year, and I think that's a good number. We do have a social worker on staff, and all of our staff who are out there know about these treatment services and know how to get access to those. And we actually help facilitate that process through our connections through King County and local providers. So we do have people who are trained to get them to where they need to get that help. It doesn't mean that we can't do more, and it definitely doesn't mean that we have enough service providers in the community to meet the demand of where we see this epidemic is.
Anna.
Okay, I'm going to add on what I was saying earlier about sort of keeping people where they're at, and just kind of the message that I've been seeing. And I've been paying close attention to this for a long time. And the message that I'm seeing is that we're trying to sort of normalize and take away the stigma of drug addiction. And I understand the premise of that, but I think we need to kind of sort of steer back to sort of sending a message that this isn't really a good idea. And I want to see more preventative. Let's not just give out pills at the doctor's office. I am really surprised that we haven't seen more effort in prevention of just sort of handing these pills out as a solution to everything. And that's how people get started. And, you know, we also have to consider, you know, we've got the harm reduction for the heroin, but we also have the meth in our community, and there's really nothing for that. So we have to not just concentrate our efforts on the harm reduction in that sense of, you know, oh, we've got the Narcan for this now, so we're good. But we need to get to a point where we don't need the needle van. Sorry, but, you know, we need to truncate it. We need to be putting more effort into that. And, I think we're kind of heading in the wrong direction here. So, you know, if the needle van were coming, I think, you know, I can understand the premise of it, and, you know, we really can't do anything about it. Number one, I want to see King County doing whatever they can to not have this feel like an attack on our city, which is what it feels like right now. And then I also want to see more effort in the prevention, getting communication out to our kids, our youth. You know, I'm concerned that the van is handing out needles to underage children. And, you know, what happens if a pregnant woman comes along? I mean, those kinds of things, there's got to be more we can do. And just, I want to see more effort being put in those other areas of prevention. Thank you.
Dennis, if a minor comes to the van, are they given syringes?
No, we don't exchange with minors.
That's not what we saw. We have pictures of it. And I want to know who is trained. Who are these people giving out the needles? What is the criteria for the job? Because some of the people that I see on and I see flyers that are saying, you know, give it a try, you know, just promoting some of these drug paraphernalia. I think we're sending this message that is cool or something. And I think we just need to kind of get a different message out there. And I want to know, you know, when we're building a relationship, are we trying to build these sort of warm fuzzy relationships, or we're kind of saying, hey, you know, when are you gonna, are we kind of trying to put a little pressure on it a little bit, and or are we just, hey, you know, want to try some of this? I mean, I want to know what the approach is. I would like to see maybe what that looks like. What is it? What does the interaction look like when the van rolls up and people are there? Is it because what we've seen is there's no questions asked, no needles expected in return, no treatment offered, nothing. And I've seen the photos, multiple boxes being loaded into trunks. So then there's this secondary delivery in our community. It's just these needles just flowing in. I've talked to businesses on the property where we saw the vans or we saw people gathering, and then I saw them all zipping up their bags. So I knew something was dropped off. I talked to the property manager, and they went from over the last year in 2020, they went from 5 to 10 needles on all 3 properties, you know, in a given month. And now they're collecting 50 to 100 per property. That's crazy. And then they're all sort of, you know, hanging around over there, and it's creating a huge nuisance for the businesses. We can't afford to lose businesses here in Federal Way. Our businesses are suffering. And so this all ties into it. And so we need to think about this in a holistic way. We need to get, we need to protect the addict, but we need to protect our community. We need to protect our kids. We need to protect our families, our businesses. We need to work together on steering this in a better direction. It's not helping. It's not getting better. So that's all I want to say about that. Thank you.
Thanks, Anna.
Thank you for listening, and I hope we can work together on this.
Andrew.
Hey, so I want to make sure, like, just based on Anna's questions, these needles aren't filled with heroin, right? When they're given out from the trucks, right? Because what I'm hearing in these questions is it sounds like that, Anna is under the impression that these drugs encourage drug use rather than try to make the existing drug use safer. And, like, I haven't seen any part of this program look to try and entice people. I see this as a compassionate program. I see this as, I'm proud that we participate in things like this because we actively want to make things better, that these things do steer people towards treatment. And I don't know, I just really feel the need to just be a voice of opposition to what I'm hearing here, because I am a resident here, and I'm happy that the needle exchange program is here, and I'm happy that people are receiving help as needed. And the quantity of empty needles that are distributed does not bother me, because I don't believe that there is any type of person who is saying, well, hey, I've got all these needles, I better go find some drugs to put in them, right? Like, I don't believe that that's how these things work.
Thank you, Andrew. And what we said at the very first meeting was that this is a place where we can all state our opinions and our statements, and that we will be respectful of each other. So I appreciate the respectfulness that I'm seeing from everyone on this committee, because this is a really, people have strong opinions about this, and we're doing very well as a group, talking about what we feel and what we would like to see. And okay, Anna, go ahead.
Can I respond? I just
Sure.
wanted to say that I hope I didn't give the impression that I thought that there was heroin or any other drug in the needle. So, and I don't dispute the need for the needle and how it protects people from HIV. I'm not fully convinced that we need it, or that it's actually helping get people to the ultimate goal of treatment and back to a functioning life. So I feel like this just sort of pouring the needles on the community, there's got to be something else that goes with it. So that's my point. I don't know that it necessarily, I think it's the message that we're sending when we're bringing the needles. I think it's the person with the shirt that says proud drug user on it. I think it's the flyer that says, give it a try some booty bumpers. I mean, I just think that making it cool to make these warm, fuzzy connections with the drug users, I think we're sending the wrong message. We need to be saying, look, this is not a good way to live. When are you going to get some treatment? And then when you maybe hold them accountable, and in the process of holding them accountable, then you make the connections, then you build the relationships. That comes next. The expectations come first.
Yeah, so
That's what I'm saying.
if I may just say one thing in response to that, Anna, I appreciate that you want to see the research and you want to be shown what we have, and we're happy to do that. But I'm not familiar with flyers that are promoting this. Give it a try, booty bumping, and T-shirts. So if you have that information, that would be good to share. Back.
Thank you.
I want to go back to this idea that of trauma-informed care and meeting people where they're at. If you've ever been into an emergency department, this is a likely scenario. Someone will come in, they may be high off of some kind of drug. They may have an abscess. They may have a UTI, a urinary tract infection. They may have bruises, etc. And they may frequent the emergency department. And later, after being there several times over a course of 6 months, maybe a year, you eventually learn that this person is a victim of human trafficking. They're being human trafficked and sexually exploited. And they're now ready to get help to get out of their situation. But every time they have gone to the emergency department, the person who was trafficking them was with them, and they never felt safe and were afraid. This person, it may be out on the street a lot, right? Homeless most of the time, or experiencing unstable housing, but they're still in this trafficking situation. And they may frequent the SCORE mobile van to get clean needles. And that their addiction is really for them a way to soothe the pain from being victimized and being in a human traffic situation. And I can't imagine me working for SCORE, handing out syringes and trying to build a relationship with someone like that. And I'm constantly saying to them, when are you coming in for treatment? This is not the lifestyle you should have. Because I don't know how they got into that situation. It is not for me to judge. What I want to do is let them know that I care and that they're human and that their life means something to me. And that I want to help them in any way that I can, whenever they're ready, whatever that help looks like for them. And that I want them to have a clean needle, because I don't want them to share someone else's and expose their body to more harm than what they're already going through. That is a real situation. That is a real scenario. And it is not uncommon. And so I want us to think about the fact that we're talking about human beings with real lives. We don't know what got them to the point to where they are using. But trauma-informed care says you have experienced some type of trauma in your life. And I don't want to add more trauma to that. So I'm coming with care and compassion. And while we may not like the fact that you're doing drugs and that it's that's out of the conversation, because what's more important is I need to build a relationship with you and let you know that I care, that I'm there for you, and that I'm going to do what I can to help you. when you're ready for that help. Because I can't judge. I don't know what brought you to this situation.
Thank you, Cynthia. Casey, and then Diana had her hand up also, but Casey first.
Just quickly, I wanted to remind everyone that we could probably expect to be have lower numbers of people going to treatment now that drugs have been essentially legalized. The VUXA laws have been invalidated statewide, and it is right now perfectly legal to stand at the driveway of the Rite Aid on 320th and shoot heroin into your arm in front of everybody. So now that aren't getting forced into treatment, by maybe some kind of sentence handed down by a judge, there likely could be a decrease in the number of people going to treatment. I just wanted to remind people of that.
Thank you. Diana, Nicole, and then Anna.
Thank you, Susan. So this question is for Dennis and Sarah. I want to piggyback on what Cynthia said, and that is human trafficking. Does the SCORE van, how do they handle somebody that they sense that is a victim of human trafficking? And do you have people that are trained to identify that?
Sarah, do you have any information about links and referrals of human trafficking in general with SSPs? I mean, I can ask our team. I don't, like I mentioned earlier, Diana, we do have a social worker on hand that we bring people into. We work closely with law enforcement if we need to through our connections. But I don't have a specific response that I can give you right now, but I can definitely go back to the team and ask that question and funnel it back through Susan.
Yeah, unfortunately, Diana, I don't have a response to either. I'm not sure, so I'll check in with the same folks with Dennis.
So is not human trafficking a part of training for the staff that you have at the SCORE van?
Yeah, that's what I'm not sure to what extent that training is included in their general training. I'll have to ask them. I'm just genuinely not sure.
All right, thank you.
Nicole?
All right. So it seems like some people are just kind of throwing comments out there. So I thought I would just go ahead and throw my own for a minute, if that's okay. I feel like the whole reason we're all here is because we care about Federal Way and we want the best for our city. We want the best future for our city. And I think the thing that we need to keep in mind of is the whole purpose of this program is to have a way to dispose of needles safely, prevent disease, provide information on treatment for those that ask for it, and to offer education on how to treat overdoses. And these are all things that are provided by this program, and they've all been proven through the statistics and the studies that they've done to actually be effective. So I don't want the purpose of what this program to be confused with our other issues with things that we want to tackle in Federal Way. Because yes, homelessness is an issue and it is very valid. Litter is an issue and we can definitely tackle that, but I'm concerned that we are throwing more issues onto a needle exchange program than it ever professed to tackle. And I think that we need to just keep in mind whether or not it's doing what it said it would. And according to all the statistics that they've provided, it is doing that. And I also just think that maybe the best way that we can tackle addiction is, instead of shaming people, is to just be good neighbors and care about them. That's all I got.
Thank you, Nicole. Anna, Casey, and Bob, and then I'd like to have some remarks about the next steps.
Mine was a mistake, sorry.
Oh, okay, thank you. Go ahead, Anna.
Okay, so I just want to respond to, first of all, regarding the prostitute scenario of, I guess I'm thinking of in terms of how we should approach the I was thinking about the drug addicts that I've seen in my community more often, not so much the ones that you've probably seen in the emergency room, but the ones that I've seen in my community, that are busting up windows. And so I'm coming from a place of frustration, and I probably wouldn't be the one that should work the van, because I probably wouldn't. But my impression is that there's more of a promotion and celebration kind of message coming out from some of the folks that are serving our homeless. I've seen that kind of message, and maybe not with the King County van, but my concern is that I want to see a message of encouragement, that I want to see, not a waiting around till you're ready, because when you're waiting around for a drug addict to be ready, it takes longer. Maybe a little bit more pressure and maybe some other strategies, because different things work for different people in different scenarios. So the scenario that Cynthia shares, that sounds like an issue where we need to address the fact that she's being prostituted and trafficked, and that needs to be addressed. And yes, I also want to respond to Nicole that while we are here talking about just the needles, it has a ripple effect, and it's a piece of a bigger puzzle, and it's interconnected with all of our other solutions and strategies. And so I do talk about all of those other things that are tied together with it, because I think we need to look at that, and we need to strategize and think about, what is the goal? Is the goal to prevent HIV, or what is the ultimate goal? We need to kind of look further down the road more. That's all I'm going to say.
Thanks,
Thank you.
Anna. Bob?
I've got to speak out today for a group that is not getting heard. And so I've been contacted by many businesses, by many citizens. And so I have a couple questions. I mean, there's a lot of collateral damage from this. And I'm sorry, I have to address this for businesses. How much money does King County give our city to help with the heroin and drug crisis? There is collateral damage here. Why have I heard everyone in support of the needle program speak about its usefulness in the community by stopping the spread of diseases such as HIV and hepatitis? And don't get me wrong, I think this is a great goal, but at what cost to our city? The health hazard that exists because of needles being thrown all over our community and trash created by the people with drug disorder is quite frankly appalling and not acceptable. What I don't hear so far in this discussion is the collateral damage and impact on the community and its businesses. I've spent this entire week walking through homeless camps in various parts of the city and talking to businesses around various places, including the area around the day center. I literally received 100 pictures of collateral damages from businesses impacted by a drug epidemic. This includes pictures of hundreds of needles around homes adjacent to parks, in front and in the backs of businesses. We are being impacted by increased crime due to the drug epidemic. This is how they pay for their addiction and their drugs. They don't have rich uncles to give them money for their drugs. This includes our cars being broken and stolen, strong arm robberies, business robberies at gunpoint, businesses broken windows, which I documented in pictures today, defecation in the back and front of businesses, people passed out in the front of businesses and in our parking lots and public places. Could there possibly be a connection of hundreds and thousands of needles being dumped all over the city by the SSPs? So my question is this: why is it all the businesses and citizens who pay taxes and obey the laws have to clean up the collateral damage of this crime in heroin and other drug use? I would like to see a conversation around how we're going to help them. Who is going to help them clean up this mess? Who's going to help them repair their businesses? Who is speaking out for them and helping them? It's devastating, the stories I heard today and the pictures. The homeowners and the businesses dealing with the fallout of the drug crisis. I'd like to know, who's in support of this program Who would like to answer this question?
Thank you, Bob. Nicole, did you want to, your hands up?
That was a mistake. I'm sorry. I'm
Okay.
generally not good with technology. I apologize.
That's okay. I've had to learn a lot about technology this year. All right. Any other comments before we talk about the next steps?
I mean, I guess just to answer Bob's final question there of the
Okay.
people who are in support of the SSPs, who's going to pay for it, and we are. We're those who are able. We, the people who can help are the people who should help, and by continuing this program, if we are achieving our goals as the data is bearing out, like the overall amount of litter, well, actually, I think in one of the slides they said that litter is unchanged despite the needles going out into the community. Is that correct? Did I see that on one of the slides?
I think so.
That's what other research studies have shown, yes.
Okay, so I see a head shake a no, and I don't have the data. I didn't collect that data, so but if we can take it on faith that it doesn't materially change the amount of litter, I mean, is there what would be involved in cleaning this up? Where is this this litter? Can we have can we safely do a community pickup? Can we organize something to do this? What would it take, and what would the proper PPE be to accomplish something like that?
So I wouldn't encourage anyone to pick up a used needle unless you're specifically trained to do that. And you can call the police department, the non-emergency number. And Casey, correct me if I'm wrong, but this is what I've been told over the last several years. And tell whoever you're talking to where you found the needles at, and the city will get someone out there to pick those up. But I wouldn't encourage anyone who isn't properly trained to handle that.
That's very good advice. Sorry, I didn't mean to imply that we should just all go out there and start picking up needles. It was just more of a call to action. So there is somebody within the city who does this. Is that's what I'm hearing?
That we will go get someone from the city out to pick up the needles if we are told where they're at.
So
I think the best way to do that nowadays is through the Eyes on Federal Way app.
Okay, and can we influence the budget for the port, whoever's involved in the city to do that?
Well, right now it'll be done no matter what.
But if it's not happening as broadly as it should,
I don't know that it's being. I don't know how many people know about Eyes on Federal Way. It's a fairly new program here in the city. Started in December 15th, I think. And you can report any problem that you see in Federal Way, from trash to noise to needles on the ground. So
I should clarify that.
Go ahead.
That's usually for public property. That we maybe people would come out and look into that kind of matter, but not for private property. If you saw it on somebody else's place, okay.
Right. Sorry.
Who would like to come down and take a walk with me? Because I've been walking the area around 336 and several other public areas, and I have dozens of pictures of the needles I found. It's devastating. I have a hair salon in that area that still, I'm going to be picking up a bucket of needles from them, and I am not kidding. So this is why I want to have a conversation around how are we going to help them. I understand the function of the program, but there is a fallout here. I would encourage any of you, I'm asking, to come and walk with me down there, and I will show you.
Yeah, it's definitely not that I don't believe you that it's there. It's just more about it's there. Is it caused by this program? Is it made worse by this program? if it's not made worse by this program, how does ending this program solve your problem?
Yeah, that was my concern. Is, to my understanding, we had paused the program while we had this discussion. And isn't the needle problem only going to get worse if there's nobody there to pick it up?
I think the program's been paused for 4 weeks now. Is that correct, Dennis?
Yes, that's correct.
So I want to remind folks that normal places that would have some of these receptacles, because there's some where you can dispose of needles in private businesses as well. They just don't always disclose that it's in their restrooms, et cetera. Like some stores may have them in their bathrooms. So I just want to encourage people to think about that it's COVID, and that where people would normally go, like the library and other places, they don't have access to put that in, right? Because we're trying to decrease the rate of infection of COVID-19. Another thing to think about is that we've seen an increase in our population. We've seen an increase in those that are unstably housed. And because of COVID-19, we've seen more and more families become homeless as well. You can go to Walmart and look in the parking lot at night and see more families staying there in their vehicles now. So with that often comes other issues and concerns. So if we were to look at the trend data over time, what the use has been over time. So let's say pre-COVID, what happened in 2018, 2017, 2018, 2019 with needles and picking them up. I'm sure if we ask the businesses over time, what have they seen with the needles? I'm sure that they'll say there's been an uptick, especially during COVID, right? Because people don't have a place to put those things. Because we've seen an increase in those unstably housed and those issues that I've just talked about. So it could be there's a multitude of factors, multiple factors that are contributing to what you see now. And it may not be necessarily because of this program.
Thank you, Cynthia. So I think we've had a good discussion tonight, and I appreciate all of you being so honest and able to talk about your thoughts and your concerns. And I appreciate everything that's been said. So our next steps are having a meeting next week, probably next Thursday at the same time, if that works for everybody. And that meeting will not, at this point, include either Sarah or Dennis. We thought that maybe it would be more comfortable for the community members to have a discussion among themselves as to what any suggestions or any thoughts about moving forward with the program. The program isn't going to end. I mean, we as a city do not have the jurisdiction to end the program. What we're trying to do is to make the program work for Federal Way. And that's why the committee was called. So if you're comfortable with having another meeting where we could, everything that has been talked about, the things that you've asked the questions for, we'll get you the answers by email this week, if possible. And having just an open discussion next week about moving forward. It's a tough it's a tough discussion, and it's something that the mayor and the council really would like your input. And we'd like to share your input then with the public health department and move forward with this in Federal Way. There's a lot of issues facing Federal Way. As a city, I have seen tremendous growth in the last 10 years. It's almost as if the city we have now and the city we had 10 years ago is different. We've had a lot of people moving in, people moving out, new businesses starting, old businesses moving away or closing. And then on top of everything, we had COVID and the pandemic and schools closed and lives changed. And, you know, it's been an extremely difficult last 14 months for everybody. I can't imagine anyone who hasn't been touched by what's been happening in our community and in our world. You know, it's just been a really hard time for everyone. So if possible, would you come back next Thursday and be ready for a discussion about your recommendations and what you'd like to see the city talk with public health about moving forward? Anna, you have your hand up?
Can I just address the sheer number of questions that we might still have lingering? That can we establish a plan for how we can get those lingering questions asked, and how we can get that, you know, outside of a meeting? How can we get that information out to the public as well? The answers to those questions.
So if you can send us your questions in writing to either myself or to Bill Vidino.
Us here.
Right.
Okay.
And the public that's watching tonight can also send their questions in to the city council. We're pretty easy to find on, you know, the city's webpage, or we will get the answers and we will talk about the answers at the next meeting. We'll get the answers to the committee as soon as we can get, but we will share the answers with the public at the next meeting.
That sounds like a great plan. Thank you.
Okay. And anytime during this week, if you'd like to call or talk to me, I would really appreciate it. I appreciate the time that you've all put into this and the thoughts that you put into this, and the very fact that you care so much about Federal Way, because this is a great place to be, and we want to keep it that way, right? So you're all here because you care so much. Sarah and Dennis, do you have anything to say to wrap up?
Yeah, Susan, thank you for facilitating. And I too appreciate the authentic conversation tonight. You know, I truly believe you don't get to a better place about your community and about people who live in your community without having these type of, you know, this is what democracy is about, right? Is how do we move forward and talk about what the challenges are and what we see from our different perspectives. You know, we're committed. We share a commitment with you. Is we don't want people to have unsafe, unhealthy lives, and we want your communities to be healthy and thriving. We know an economy, your businesses are all part of a healthy community and promote health way beyond anything else. And so it's important, and we share that same goal with you. So I hope the conversation from our part in sharing the data, sharing the stories of our group and what we're committed to doing in no way reflects that we have a different opinion and an outcome that you want differently from your own community.
Thank you, Dennis.
It's hard to follow Dennis. I appreciate all the same things that he said. I cannot say better myself. I especially appreciate this group's openness to hear about the research. As a researcher, it sounds like we have had an open conversation about that, and Anna, I will be following up and sending you more of the information that you requested, and eager to hear your additional questions. And I just wanted to thank you for your time. I know it's been a couple long meetings, and I've learned a lot from you. I hope you've learned a little from us, and looking forward to answering more questions if they come up.
Thank you very much for all being here and for talking so freely with us. I truly do appreciate that. So if there's nothing else, it's been 2 hours and 5 minutes, a little over what we thought. There isn't anything else. We'll say good night and thank you very much. We'll get you the information you have asked about tonight, and please send us any questions that you have. And yes, Bob, I saw your hand. Oh, you're waving? Okay. Sorry about that. All right. Good night, everyone. Thank you for being here. And thank you very much, Dennis. And thank you very much, Sarah, for your expertise.
All right.
Thank you.
Good night.
Be safe,
Thank you.
everyone.
Thanks. Good night.
Thank you.
Thanks, Anna.